Welcome, welcome. My name is Dr. Court, and I am here with Jonette Biebensheimer, and we're very excited to welcome everyone to the Optimal Longevity series this evening. We have our illustrious Dr. Prasad, and before we get started, I've got a little bit of housekeeping to take care of. These statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any diseases or injuries. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition we are lacking. Nothing here is intended to be a substitute for treatment or a visit to your primary healthcare provider.
Well, welcome everybody to the Optimal Longevity series. I'd like to introduce my co-host, Dr. Russell John Court, lead clinician of Dr. EMF, and I'm Jonette Biebensheimer. I am the lead researcher, and we're going to go ahead and pull up our presentation for tonight. And I'm going to get it. Let's see, I've got to get it to play. There we go. No, it doesn't. All right. All right, Dr. Court. So tonight's call is a really important one. It's Dr. Prasad's latest paper. And it is, I wrote this summary for Dr. Prasad and I had him review it, but it is really a novel approach presented by Dr. Kedar and Prasad for the prevention and improved treatment for hearing disorders. And we're going to learn a lot on this call tonight. So if you don't have your pen and paper handy, I would be getting one. All right, let me see. I'm sorry, I'm having a difficulty with the screen share. Oh, there we go. Oops, did I go too fast? Oh. All right. I was a Johnny Fast Clicker, Dr. Prasad.
Yeah,
Dr. Prasad and Dr. Court. What birthday was that?
89.
His 89th birthday. And
yeah.
then we have a picture, which I love. And then we have a picture of Dr. Court, myself, and our EMF hypersensitivity service dog, Kaizen, a picture of us, and then a picture of Dr. Court, and I mean, Dr. Prasad and I, over 8.5 years ago.
Yeah, at that time, my hairs were all black.
It was black. So let me do that. And so we're going to go over Dr. Prasad's accolades. Would you like to read them?
Sure. Dr. Prasad is the world's first PhD radiological biologist, graduating from the University of Iowa in Iowa City in 1963. I always like to add the fact that he actually completed his coursework 4.5 years ahead of his other, I believe it was 6 classmates. In addition to that, Dr. Prasad also discovered the anti-cancer potency of vitamin E succinate, as well as discovering that butyric acid, a small fatty acid formed by fermentation fibers in the gut, is also an anti-cancer agent. Dr. Prasad taught at the University of Colorado School of Medicine in Denver for more than 30 years. He was the director of vitamin and cancer research, and he's also the former president of the International Society of Cancer and Nutrition, London. So right? For more than...
No.
Oh, just that. Okay. Yeah. Oh, no, there was the other one.
Yeah.
And he was the president for more than 10 years. He was also invited on the Nobel Prize nominating committee for candidates in medicine back in 1982. Is that right?
Mm-hmm.
I think that's right.
Is that right, Dr. Prasad?
Yes, yes.
Okay.
Okay, and he attended his postdoctoral training at the Brookhaven National Laboratories in New York, Long Island, New York. He has authored or co-authored more than 33 books, textbooks. He has published well over 250 peer-reviewed articles, and he is listed in PubMed more than 450 times. It is just such a great honor to be able to talk with you on the Optimal Longevity series, Dr. Prasad. Welcome and thank you.
Well, as you know, I always enjoy talking with you and Jeanette and the entire Engaged family. And whatever I can contribute, I'm always happy to do that.
Thank you.
And he's also the world's foremost expert on radiation.
This is true.
All right. So tonight's call, the reason why we named it the Optimal Longevity Series is Dr. Prasad really embodies this. It's just
Heart, soul, and every fiber.
Every bit of it. Your lifespan is how long you live. And that's the top part of this graphic. But your health span is how many years you live a healthy, vibrant life. We want your health span to equal your lifespan. And the top part of this graphic is where we really are today in the US and in the world. And specifically, the age-related disease we're talking about right now is hearing diseases.
What was that?
Hearing diseases.
Yeah.
The bottom part is really optimal longevity. We want you to be able to do the things you love to do with purpose, like Dr. Prasad, still writing these peer-reviewed papers and books and doing the things that he loves at 89 plus years old. And so that's why we really call this the Optimal Longevity Series, and the topics we bring in here is to be able to educate and enlighten based off of Dr. Prasad's body of work and the work that we've done.
Mm-hmm.
And we're just really happy that you guys are here. All right. So let's get right into it, Dr. Prasad.
Okay.
Okay. This is Dr. Prasad's latest paper on hearing disorders, a rationale for using a micronutrient mixture, probiotics, omega-3 fatty acids, and collagen peptides to prevent and improve their treatment. And so the next few slides are really going to summarize this paper, but please, you can go to the World Journal of Pharmaceutical and Life Sciences, and you can actually download a copy of this paper. So Dr. Prasad, before we get into the first slide where we start going over the introduction, why did you write this paper?
Because there is a growing incidence of hearing disorder. And when I looked the research on this issue, I found there is almost nothing for prevention, except for example, you don't get too much exposed to noise and sound and things like that. And also, where treatment is concerned, they are all treating the symptoms of the disease. So you have a hearing aids, that doesn't do anything to prevent further progression of the disease. You have a cochlear transplant, but again, cochlear transplant can be useful for some time. But again, until the cochlea of the ear, this is one of the structure of the ear, cochlea, is healthy, and they will deteriorate faster. And
Right.
They use some anti-glutamate agent for treatment or a steroid, but they're all toxic. So I said, how I can develop a non-toxic approach that can also prevent it, and in combination with the standard therapy can further improve their efficacy. And that's the reason I thought. Two of my friends, actually, which is same age, both are deaf. And I'm lucky I'm not deaf as yet. But, these are all progressive disease. And so I found out what are the problem of hearing loss. So first identify the problem and then discuss those things. And then I said, how I can solve those or attenuate or decrease all these problems that leads to hearing disorder in the initiation and progression aspects. And then I will say how I can reduce them all at the same time. And that's why Code 4 comes into picture.
Beautiful. We're going to go to the first slide. All right, Dr. Prasad.
Yeah.
These slides are yours to go over, so.
Okay, hearing disorder, as you know, is a complex disease of the ear, which include partial or full loss of hearing. And it is amazing. In 2023, the National Council of Aging reported that 60 0.7 million Americans of age 12 and older have a mild hearing loss, and almost 21 million of them over 60 years old have a severe hearing disorders. The prevalence of hearing loss is on the rise in the US. This is another reason why I wrote the paper, because it was incidence is increasing, and it is expected to increase to $73 or $74 million by 2016. And while economic cost is $105 billion, you can see that it is not only that contributes to poor quality of life, but also it is a national cost. And this is another reason what drives me to write this paper. And worldwide, approximately 20% of the world population have some degree of hearing loss, and the annual global cost of managing this disease is $980 billion, almost $1 trillion. So not only costly, but most important, it interferes with the quality of life. You can't communicate with your friend.
Mm-hmm.
Then there are different types of hearing loss. One is called conductive hearing loss, sensorial hearing loss, tinnitus, that's very common. In America, 41 million Americans have a tinnitus problem, which is ringing in the ear, also called. And there is another disease, genetic disease, Meniere disease, and then congenital heart loss also among the children. Many times they are born because of the infection with the viruses.
Of cytomegalovirus?
Yes, yeah, that's very important to remember that.
Yeah.
And here is the quality of life and current treatment. 1/3 of American population at the age of over 50 years has significant adverse effect on their quality of life, such as social interaction, communication, mental health, and personal relationship because of the hearing loss. Despite the importance of rising incidence of hearing loss, there is no effective prevention plan except for reducing exposure to intense noise, musical events, and war zones. But some of these are beyond our control. Only hearing aid, in terms of a treatment, only hearing aids, cochlear transplant, and steroid and anti-glutamate medications are available for improving the symptoms of hearing loss, not the causes of the hearing loss. It is symptoms. Until you address the causes of hearing loss, these drugs may loss sometimes cause toxicity and won't be very effective. And so that drives me, these kind of issues, when I became aware of, drove me to write the article where, as you will see, that I have addressed all these problems.
Did you read the last one? None of the available
Preventive or treatment devices and medication addresses the root causes of hearing loss. None of them. They treat symptoms. This is true for all diseases. Here is hearing loss due to external stressor, external, outside. And external includes chronic and intense noise, just like you go to hearing some music. Vibrations, you can see that sometimes they get developed because they work in home and cause vibration, noise at the same time. Another drug is gentamicin, ionizing radiation, well known, causing hearing loss. Cisplatin, large dose of aspirin, bacterial and viral infection, gene mutations. And this is very important. And aging, of course, aging is always associated with the hearing loss. And troops in combat zones, musicians, and industrial workers are more exposed to intense noise, and they are likely to develop varying degrees of hearing loss. All external stressors enhance the level of internal stressor. One thing here I forgot to mention it, and it's my fault, was the exposure to EMF radiation, which is also has become a part of the environmental external stressor that can also, because your ear is get exposed to, especially when you put some of those things in your ear. And so I think I would have included, and so in my talk, I think Dr. Court can include those events, how the EMF also can influence, because EMF also produces free radicals and inflammation causes, and they will cause damage to the structure of the eye. I mean ear. And so these are very important things to remember, that among external stressor. That's why you will see the many musicians, well-known musicians, always have a hearing problem in the later on because of the noise that they are exposed to.
Do you
So
think
the question is, what kind of, Go ahead.
Do you think that also the earplugs that they wear,
the AirPods,
the electric?
Yeah, that's a part of that. Yeah, of course, but it is much less than say your, the amount of energy gets through that one is less than if you put directly cell phone on your ear.
Oh yeah, but I mean, as musicians, a lot of them wear those waxed.
So yeah, they reduce it, but at least the intensity, the energy, vibration that occurs on the stage, they can influence it. So they don't develop right away. It takes time to develop it.
Right, but those are amplifiers, so they can hear what they're playing.
Yeah,
and everybody else. So it is directly going in
to the brain,
to their brain, and we're going to talk about that in a moment.
Yeah, and so you can see that all the external stressor that we define, they causes damage. They cause the increase in internal stressor. And internal stressor, we include following: increased oxidative stress, they cause inflammation, they cause increase in glutamate, and is very neurotoxic. Intestinal dysbiosis, I don't think it is directly related to that, but in aging process, intestinal dysbiosis occurs, and that further aggravates the already, in the process of initiation of hearing loss, they further contribute because they produce a lot of pro-cytokines, inflammatory cytokines, and they are, as you know, very damaging. Loss of collagen is extremely important, as you know, for every organ, including hair. And hair, in ear, they have at least collagen type 2, 4th, and 9th are extremely important for hearing issue. And if when the whole collagen down from your skin, you can see it. But what happens in your ear, you can't see it loss, but loss is occurring there also if it is occurring on your skin. And so that's very important to remember. Then they also decline in omega-3 fatty acid, because not only they decline in a level, but also since it is increased oxidative stress, and fatty acid easily get oxidized. And when they oxidize, they act as a pro-oxidant or like free radicals, then function. So it is become a worthless piece there. There are some, and so it is very important to prevent their. That's why in our formulation, I think we have put some vitamin E to prevent oxidation, and of course gene mutation, as you know, they will cause the hearing disorders. But one thing I want to mention today, this is nothing to hearing loss, but this is related to omega-3, because I just saw a paper came out in a Journal of Heart Association that omega-3 increases the heart disease by 17 or 18%. Then it reminded me almost analogous study of beta carotene and it is older individual, and beta carotene stent trial on a heavy smoker, which increases the lung cancer by 17%. Now the question is, why it happened? Well, you could have predicted it will happen because older people have high oxidative stress. If they are not doing anything, they will have a high oxidative stress. And if you give a the omega-3 alone, it is a fatty acid, it will get quickly oxidized. So it will not act as a antioxidant or as a, you know, once they get oxidized, it has no function. So EPA and DHA and is all gone. And so it will act as a free radical, and therefore it will increase the risk of heart disease, just like a beta carotene increase the risk of a cancer among heavy smokers.
So it's actually causing lipid peroxidation. It's actually
Yeah,
causing it.
I mean, I just don't understand why these guys never thinks when they tried clinical study and they get wide publicity.
Right, with one micronutrient.
With one micronutrient, just omega.
Right.
Knowing fully well it is highly oxidizable, knowing fully well that older people have a high oxidative stress, why you are trying it? Same thing with beta carotene. People knew that heavy smoker have a high oxidative environment. People knew that the beta carotene will be quickly oxidized and will act as a free radicals. So I fail to understand people are doing it. And but our job is to do whatever we can.
Well, it's to educate your multi-micronutrient approach and
Yeah.
the work you've been doing, your body of work for many decades.
And also that you have to address all these issues, not only just oxidative stress issue. You have to intestinal dysbiosis issue. You have to address loss of collagen. You have to reduce omega-3. I mean, all this at the same time. Otherwise, you won't get a good result.
And that's what you walk through in this paper. And
Yes,
I did.
that's what I tried to emphasize, that this is the first time anybody has proposed that all the internal risk factors have to be down-regulated at the same time, and we know how to do it.
Yes. Safely.
Yeah. So hearing loss cases that you have, approximately 50% of all hearing loss are due to mutation in genes. And 50% are acquired due to exposure to intense noise, infection, radiation, trauma, ototoxic medications, EMF radiations. And so that's interesting. It's about 50-50. The internal stressor cause ototoxicity that includes damage to the inner ear parts, such as cochlear, vestibular, sensory, or also there are hair cells. So you can see that this happens, and this is very interesting, and Dr. Court will do it.
Well, this is my favorite part, and I want to just look at digital hygiene for a moment. And these man and the woman, I want you to think about, where do we put our phone? First of all, we look at our phone without any protection on our eyes, and our eyes have not changed since the beginning of humanism. And then we put the phone against our head.
Turn sideways so they can see that.
They can see me.
Okay.
We put the phone against our head like this.
Okay, I can't see, nobody can see you.
They can't see me? Okay. So
Okay.
we put the phone against our head like this.
Or AirPods.
Or AirPods. Now, AirPods run on Bluetooth, and now, very importantly, they're running at 2.4 gigahertz. Check it out. This is an important number for you to look up, and just check it out regarding microwaves. They call it millimeter wave, but it's really in the microwave range. So we put the phone against our head, and this is where our brainstem lies, right here between the ear and the first cervical vertebrae, the atlas. When we don't point it here, we point it at our throat. But I really want to focus on the brain. And we're going to go into really quickly, we're going to talk about 12 cranial nerves, or just
talk about it really briefly.
Okay,
please.
really briefly. When we think about, we have 12 cranial nerves that run on both sides of the brain. The first one has to do with smell. The second one has to do with vision. The third one has to do with vision. The fourth one has to do with vision. The fifth cranial nerve runs like this on our face, okay? Has to do with sensory above our eye, in our cheek, and in our jaw. And this is a major, major nerve called the trigeminal nerve. Why is this so important? because it's right next to the sixth cranial nerve. And the sixth cranial nerve has to do with vision. The seventh cranial nerve has to do with the tongue and the mouth. And the eighth cranial nerve has to do with balance and hearing. Then the 10th, I'm skipping the ninth, the 10th cranial nerve is the vagus nerve, the longest nerve in our body. And it has to do with the function of most of our organs. So when you think about the 12 cranial nerves, it's really, you know, cranial nerve 1, 7, well, 7's involved, cranial nerve 9, 11, and 12 that don't have something to do with how we hold our phone against our head. They're all affected. Every one of them is effective, and every one of them has a response to the EMF radiation,
To the external stressor.
that we're exposed to.
Okay.
Yeah.
This is a very interesting study. It wasn't done by us. It was done by the Environmental Health Trust, and it's measuring the radiation of wireless ear pods in the ears. And you can see the amount of radiation. Now, the adult on the left-hand side, you can see the radiation created from these wireless ear pods.
Actually, it's temperature.
Temperature. It is a temperature reading that's caused by the radiation of the temperature that's emitted from the AirPods.
Correct.
Wow.
Then you look at the difference with a 10-year-old, and a 10-year-old has a much smaller head and more, it's not as thick. Their skull is not as thick, and it's not as wide as an adult skull. And so the damage is much more profuse. It goes into the brain much deeper. And then we look at a 6-year-old, and a 6-year-old is even more penetration in and around the skull. You can see all the redness around the head from the AirPods. This is a very big deal, because with a lot of our phones, they include a set of AirPods. And in my opinion, and Jet's, they're toxic. They're toxic to the brain, and they'll never be in my head. What did you want to add to that, Jet?
What is the AirPod?
AirPods are those little ear magnifiers that they put in their ears.
They put them inside their ears.
And they can talk without putting their phone to their head.
Oh,
There's a transmitter that picks up Bluetooth from the AirPod, so you can make a phone call and speak on them. We use a wired headset, and I think that's the safest way to go.
We use an air tube.
Right, an air tube that plugs into the phone.
And it's about reducing exposure. For everybody on here, the heat is an example of the external stressor of the Bluetooth, which is not very much radiation, Dr. Prasad, 0.4 watts. It's not a lot. Can produce this amount of heat. When we have the heat, indirectly, we can talk about the internal stressors that Dr. Prasad has just gone over. Oxidative stress, increased neuroinflammation, right? Excessive glutamate toxicity, all the way down. This is a really good image for everybody to be able to look at, even with the Bluetooth, not even with your whole phone up to your head. This is the amount of temperature that's being raised from the exposure of the AirPod in the ear.
And you can see the redness on the 10-year-old and the 6-year-old and the 34-year-old. And, you know, it's about time, distance, and shielding.
We're getting there, DK.
And we're gonna talk about that.
But I want you to know, normal heads aren't this red. And because we do fluorothermal imaging, this isn't abnormally hot, not just around where the AirPod is. The temperature is it's not optimal. And it's hindering other chemical processes, Dr. Prasad, because as you know, when you change temperature, like pH, when you change temperature, you affect many things. So Dr. Court wanted this again. Did you want to say something before we move on?
Well, I wanted to remind people, your brain is the only one you have, and we have to take care of it from the beginning of our life all the way to the end of our life. And when we put devices that have radiation coming out of them, EMF radiation, electromagnetic field radiation, it has a profound effect on the longevity of our health span. And
I wish we could have put the ear on there, Dr. Prasad, so people could see right where it breaks off in the brainstem and the pons and the medulla. Right there is where the phone is, or the
No, I
AirPod.
think that, I mean, Dr. Court explained nicely. It will be
it
also.
is the most vulnerable part of our brain is through our ears, because we don't have ear gates. We have no way to shut off. And now we're putting this electronic device directly against the brainstem and the brain.
All right. So we're gonna move on through. Woo!
You got me going.
Okay. We're gonna recap last week, if for those of you that weren't on. This is what we were talking about, Dr. Prasad's novel paper, his groundbreaking paper on the proposed implementation and concepts of ALARA, which means as low as reasonably achievable, and PAMARA, which is protection as much as reasonably achievable, to reduce the health risk of EMR radiation. And this is specifically, now we're talking about the ear. Okay, and this is one of those external stressors. So we went over this paper last week, but what I wanted to do is just really dovetail this in. It is a novel approach. ALARA meaning Dr. Court saying what we have to do, and this is Dr. Prasad's novel approach to be able to protect us from EMF radiation, would be time, distance, and shielding. Time that you hold that phone or that AirPods in your ear, right? The distance it is away from your head. And the last one would be shielding or using a different type of technology to reduce exposure. That's a physical way to do that. Dr. Prasad's presenting that we have protection as much as reasonably achievable through scientifically validated micronutrients from his research to reduce health risks from EMF radiation. Dovetailing back into, we're talking about the ear, and we're talking about hearing disorders. And one of the biggest things that we forgot to talk about really quickly is we've seen clinically with our work really increases in tinnitus, Dr. Prasad, like massive, but also vestibular issues, the vestibular cochlear, right? And we're seeing, those are two big issues we're seeing a lot with people that have EMF radiation exposure symptoms. And so we wanted to bring that together.
Well, and it's, you know, this is so important, Jonette, because it was the pain that I felt in my head back in '99. Well, I had burning in my hands when I held my phone. And when I put it to my head, it was so painful that I didn't want to have my phone anywhere near my head. And this is really what started our journey. I mean, I was always looking for different phones, but this effect of the phone back in 1999
was causing the external stressor from that phone, was causing the internal stressors, right, Dr. Prasad?
Yes, that's right.
Okay.
And the paper that you sent me, that was from Dr. Hardell, who is a pioneer in this area of EMF radiation. And he has done in 7 or 8 cases, human cases, and found a great deal of disturbance in their health. And he said that 5G should not be allowed to. He was very revolutionary. He said 5G should not be allowed to come into market, but it's too late.
Yes, and
you know, the hazard.
Dr. Prasad, besides the case studies, for everybody on here, there is no current safety study for 5G. Dr. Prasad's noted that in his paper, but that's just a fact. So
I mean, even if it's a low one, there is no safety precaution, you know, what to do. They will say reduce the dose. But how can you reduce the dose? Nobody followed that.
Right.
Well, in the time, Dr. Prasad, you know, time is such an important part.
Yes.
When we take it back to x-rays, when I had to take x-rays, and there were times when I had to make the exposure longer because the person was just thicker. And I can remember shooting that x-ray and just being like, made me feel horrible because I knew what I was doing. This is something that's innocuous that we don't really think about. And
don't even
our
think
phones, like you said to me when you said, this is going to be one of the biggest catastrophic health crises our planet has ever seen, because we're never without our devices.
Yeah,
And it's the
exactly.
time, folks, that we spend holding our devices, having our devices on us, having
our head.
them in our head. You know, I gave a consultation to a person today, earpods and a watch, and we had to talk about all the things that were making him sick.
All the external stressors causing the internal stressors
Yeah,
that were documented.
And this was a neuro-ophthalmologist or optometrist who was having problems with his brain and never thought about his digital environment.
Yeah.
Yeah.
Okay. So here we go, Dr. Prasad. I'm sorry we took a
No, that's very important. The question is, so how do you accomplish the goal of Pamara? How you can do that? And you can see that in this scenario, you have a micro daily mixture that first reduce as much as possible the external stressor. We always say that. Dr. Court says that, but the problem with is that the industry do not follow it. Nobody's doing anything except very few of us are promoting this idea to even reducing it. Is not widely promoted like by federal government or anybody else. And so the promotion aspect of this issue is very minimal. But anyway, so whatever the external stressor is, we can't control it many times, but we can control the internal stressor is in our hand. And it is easily, you can implement it in your life. For example, micro daily mixture, micro daily EMF we have, and this will affect some, not all external stressor, but some internal stressor, just like for example, it will reduce oxidative stress, it will reduce chronic inflammation, and it will also prevent the toxicity of glutamate on the ear structure. So you can see that it can do some good, but not 100% good. To get 100% good, you have to use other internal stressor. For example, we have intestinal dysbiosis. So if you use a probiotics boost, that will reverse intestinal dysbiosis, and that will be very helpful. Then we have also loss of collagen occurs, and therefore one of the internal stressor is a loss of collagen. By giving a collagen peptides, we can enhance the level of collagen type 2, 4, and 9, which are very important for maintaining normal hearing. So you can see that if you don't give them, you will have some effect, but not the optimal effect. Then you have an omega-3 daily, would enhance the auditory sensitivity to sound, which is very important, also by maintaining the blood flow to the cochlea, because somehow, because of the oxidative and inflammation, the blood vessel get damaged and the cochlea don't get enough blood. So omega-3 enhances the flow of the blood to the cochlea, and therefore you can hear very nicely. And so these are very simple. You can easily implement it, and you will have enormous benefit in terms of preventing it, as well as the same strategy could be also combined with your current therapy, whatever you are doing it, so there is no further progression. Because all the therapeutic strategy that we have today, it treats the symptoms, not the causes. And in this case, we are doing both. We are improving the symptoms and taking care of the causes of the disease. And therefore, it will enhance the efficacy of whatever drug or whatever the treatment strategy you are having.
So what you're really saying to Dr. Prasad is that if people have a cochlear transplant or they have other treatments, that this can also help improvement, even if they are down that pathway, not just prevention, but also improving that treatment. Because there are a lot of people that are suffering that have these different types of cochlear transplants or different types of devices, as well as steroids that they're using to reduce the inflammation, and or would they even need the glutamate reducing medications, Dr. Prasad, or do you think
they treat them with anti-glutamate agent? This
Right.
is one of the standard treatment.
Well, and even the hearing aids, Dr. Prasad, people can answer their phone through their hearing aids, but that's a Bluetooth hearing aid. So
Yeah.
Yeah, and hearing aid, again, it is improved with some, but progression of the disease continue to occur.
right.
You have to readjust again. So this is a nightmare. And so if you combine with our strategy, the progression will stop, and whatever you are using it, efficacy, maybe you don't have to use a anti-glutamate if you're hearing because good anti-glutamate agent is also toxic. It causes toxicity, side
Right.
effect.
Well, and Dr. Prasad, if we work on the intestinal dysbiose, our body should make, our good bacteria should make more GABA.
Yeah.
So that we can be able to help that.
Exactly. Right? That's another one. Yeah, that's right. He is a inhibitor, neurotransmitter, and therefore it will be helpful.
When we look at core 4, I love core 4. So happy to be, when we started this, we were with you when we just had the military micronutrient formula.
Yeah.
And now we have the EMF formula, which I'm so grateful for, not only for me, but for the rest of the world.
Yeah.
And we, and I mean the collective we on this program, as well as others in the company, are going out one by one to share it with people and explain the importance. And that's what we always try and convey on the Optimal Longevity series. And then the probiotics, so essential for the gut, because we also point our phone at our gut.
Yeah.
And we sit with our laptop on our lap, which is a whole nother talk.
Mm-hmm.
So the dysbiose, bad bacteria, love radio frequencies. And so we end up with this dysbiose. Is that correct?
Aggravated, get aggravated. You already existing it.
Right. And then
They get aggravated
I didn't realize that about the hearing with the omega. I feel when I'm feeling eye strain and eye fatigue, the omega changes that inflammation so quickly. I mean, it's within minutes. I feel relaxation coming into my eyes from the omega, but I'm excited to hear about it with the ears because I do have some tinnitus, and so many have tinnitus, and as well as the collagen. But let's take it a step further.
Hang on. I think that the blood flow that the omega-3 brings, Dr. Prasad, is really important for that. But I think that one of the most really things for me that was really unique and interesting was really your research on the collagen daily, our collagen peptides that are patented. All of the other 3 above are patent pending, but this patented collagen, why is this? I think this could be a really pivotal, this finding that you did in your research. Why is the collagen peptide, our peptide, so important to be able to help with the structure of the ear?
Yeah, I mean, collagen peptide, for example, get converted to, say, for example, in amino acids, and then cell picked up. And for example, each cell type have a different types of need for a different types of collagen. So they have a gene to produce that particular type of collagen. For the skin, you have type 1 more than type 3. A brain has a type 6. And so cell have a different, and in case of ear, you have a genetics to make a new collagen, type 2, type 4, and type 9, and they make it. And so collagen peptide, this was very surprising for me because I didn't think collagen can have an important role in hearing disorders, but my knowledge was not at that time. When I started doing research, I was surprised to find out how relevant it is, collagen peptides, for ear disorders. And I think, if I have to rank, I think I will rank number 1, of course, micro daily, omega-3, and third would be collagen peptide, and fourth would be the omega.
Probiotic.
Yeah.
And then.
Hang on, I gotta say this. But for you on here that don't, this is why this is so special. This core 4, Dr. Prasad wrote about it in this paper.
Yes.
For each pathway, which I didn't go through in this call, because only maybe Dr. Prasad and I would really have fun doing that. but he walks through each mechanism of action, how each one of these products that he developed will help with that internal stressor to make it
Yes.
optimal in particular for the hearing disorders.
Yes.
And which is novel because those are the root causes of all diseases. But in
Yes.
this paper, it was
Yes.
it's never been done, right, Doctor? No one's ever written. This is a comprehensive approach for people to prevent and improve the treatment of hearing disorders.
Yeah.
That's a big statement.
Yeah.
Go ahead, Dr. Prasad.
Yeah. I mean, for prevention is the best approach. For the treatment, you will not further the progress your disease. Because despite of the current treatment, they will continue to progress because it does not address the causes. And I feel bad that, and I want to give a credit to Dr. Court because of him, we developed the micro daily EMF formula. And I have to do research extensively, but has he not brought up this issue? Because I was totally ignorant about EMF radiation hazard, because I did not do any research on that. So I thank you for that, and company will thank you for that as well.
Well, I thank you, Dr. Prasad, for, first of all, I'm blessed to be able to feel the electric fields. It's like a superpower, and it gives me a platform to shout to people that, hey, you don't want to feel what I feel, but we're all exposed. None of us are immune to.
No, that's the thing. And this is thing that, Hardell was pointing out in that paper that, Janet, that you sent me, that how it is that everybody is ignoring it. So what I did, I sent him my paper. And I said, I enjoyed your paper very much. And here is paper I have written. And because he's retired, people don't read very much like me, until I am doing some specific project. And so, but I don't expect any reply, but at least I said, I support your view. And so, and send him my credentials so that he doesn't think I'm some weird guy.
The other thing that I'm very blessed about is to have a researcher like Jonette, because
of course,
it's about me being able to feel it and the effects. And if I didn't have a researcher like Jonette, who was
the one, when I said you means, both of you in terms of because you have become one.
But it's not only core 4, and I want to share this with people because I love core 4 plus 3.
Yeah, okay? Of course, this is very important you mentioned.
For everybody on the call, core 4
is the basic. And then if you have, for example, if you have a disorder for sleeping, say, for example, we have a sleeping boost I take every night. If you have anxiety and depression, I take the CBD. If you have some issue of eye, for example, eye pressure or any kind of eye issue, we have a eye boost. And then you have a brain, give extra brain. If you're concerned about dementia, we have extra brain boost. And so I think it sometimes it become a cost issue, and therefore at least the minimum you have core 4. And then if you have a need for, then you order it rather than as a routinely.
Well, we also have the digestive boost, but
a digestive enzyme. This is digestive enzyme very important, especially for older people like me, because the organ, as you grow older, the organ who secretes digestive enzyme decreases. The level of production decreases. And that's why you have a constipations, bloating of the stomach because it's not being digested properly, many people. And as a matter of fact, in some place, this digestive enzyme is extremely important for older people. And just take with the meal. I mean, it is one capsule, just take with the meal. It is very harmless. And but probiotics is so important. Sometimes somebody, like one time my son overeat in a party and drink and so on. So she has some filling up a stomach, And he said, I took one probiotics, everything quiet down right away. Not right away, but within a few minutes. So in other words, the probiotics is so important because if you abuse yourself, fatty diet, they enhances the intestinal dysbiosis. And so I think every item we have discussed it, and I think these probiotics is almost on the verge of getting approval.
Almost, well, it's patent pending, so it's almost ready to be patented.
Yes, verge of getting patented.
You heard it here. You heard it here, folks.
It's so exciting. But, Dr. Prasad, you may not be aware of this. So the Core 4 is our flagship now product line. But when they order, say, the Digestive Boost, they get $10 off their order on the Digestive Boost, $10 off that bottle. And then when they order the Eye Boost or the Brain Boost, they get $15 off that. And they get $20 off their third product that they order.
I think the company has done very, very, what you call, generous in terms of providing support, financial support in that way so that people can afford more. But, those things I don't follow up very well. But
it's a $78 value. And then they also give you reward points the longer you're on product. And so it really is like you get almost 1.5 products for free. And the Digestive Boost, all the products for the Core 4, everyone that's on here is quality of life, optimal longevity. And then if you have the other issues, you can add those in. And for me, we just always travel with the Digestive Boost, Dr. Prasad, because we never know what this guy's going to have for dinner. Right. But I wanted to say this on his paper that he wrote, this novel approach for the prevention and improved treatment of hearing disorders. There are 131 citations in this paper. And I know that it is groundbreaking, and how we dovetailed your paper on how to protect us, strategies to protect us from EMF radiation, that hopefully people on here can start implementing that, and that not to be afraid or fearful, because there are no safety standards for 5G for humans. There's just not. Okay. But that we can take the control ourselves to be able to reduce exposure.
That is in our control. We can't control what the government or the industry is doing. We can't be on our control. But this one we can control and protect ourselves despite all those things, what is going on.
Right.
It's really about the digital hygiene. How much time you have your phone.
Well, it's about reducing your exposure to the external stressors that create the internal stressors for all diseases. Okay. And it's trying to make it simpler, for people, because there's all kinds of stressors. But I think that what you were trying to allude to, Dr. Court, is that the X-ray is one and done, and it's a massive amount of ionizing radiation, but the overall ambient, we have to really start thinking about time, distance, and shielding, and that's what you proposed. And with the MARA, which is really through the scientifically validated micronutrients that we just talked about tonight. So we're gonna let him go because it's
you need to take your digestive enzyme because you're going to dinner. We love you. We thank you for your time.
Thank you. Very much.
Don't forget the digestive enzyme. And have a great dinner. And thank you so much for blessing us with your presence. We all want to have a lifespan like yours.
A health span.
Health span like yours. We want to be cognitively sharp well into our 80s and 90s. So thank you.
And that's it.
You will be. I started taking it late, but still I'm doing okay.
You are doing okay. We'll see you next time, Dr. Prasad, on the Optimal Longevity Series.
Thank you, Dr. Prasad. Bye-bye.
Wow.
Hang on, everybody. Stay on. But thank you, Dr. Prasad.
Thank you.
Okay.
Wow.
Woo!
That it never seems
like
it's enough time,
Well, there we go.
We just don't get enough time with them.
I know, but I want you, for everybody on here, just to recap, the true genius in his body of work we have this opportunity to learn from him. And he is so cognitively sharp and just doing his work to save humanity and bring to light strategies to help us protect our family from many stressors, because he is the expert of heavy metal stressors and smoking and many other things that cause external stressors. But we have strategies, and from this call is really how he has developed the core 4 in this paper to be able to help us to be able to have that optimal longevity. So,
well, in wrapping this up,
get back to the person that invited you on this call and say you're ready to get started.
and be fearless. Don't be frightened, but when we look at EMF, it's all around us. In your apartment complexes, in your workplaces, on the highways with all the people on their Bluetooth, and they have their GPS on. It's all around us, and we would not have been where we are today if it hadn't have been for me being sensitive and feeling this, and Jonette being ruthless in trying to figure out how to help me.
You mean ruthless?
Ruthless in your driving to figure it out. There are so many stories that we'll tell you when we're in Utah.
No, we won't. No, we
I'll
won't.
tell you. But there are so many stories. There are so many things that we've done along this pathway for the last decade of how to start to protect people. And now it's your turn. We're all in this together.
Lastly, first step, reduce your exposure at night. When you're educating your family or your loved ones or friends, we reduce that at night, because that's when we heal. And so that's a lot easier than trying to say you've got to do all these things during the day. Reduce your exposure at night. You need to sleep in a cool, dark room. It needs to be a sleep sanctuary. Reduce all exposure to the best of your ability. And of course, take Sleep Boost 30 minutes before you go to bed. And you're going to have, and we're measuring this. We've been gathering data on the Sleep Boost, and I want you to know it really is an incredible product that provides the building blocks for us to get restorative sleep. So I wanted to focus on starting there.
Well, and in reducing your exposure at night, unplug your lamps, charge your phone at the other end of the house.
Turn off your router.
Unplug your router. Do those things, and you'll start to sleep better, and your brain will be restored. So
that's it.
Do you have anything else to add? Get back to the people that put you on this call. We're so grateful for everyone on the call. Invite more to the call next time, and make sure you get back to the person that asked you to be on this call, because these calls are going to do nothing but get better. We have so much more information to share with you. Have a great night and be well.
Be well. Good night.
Good night, everybody.